My name is Dr. Ashanuthi. I'm a medical retina specialist in Oceanside, and I want to talk to you about diabetic retinopathy. Diabetic retinopathy is effects of long-term diabetes on the blood vessels in the retina, which is the lining in the back of the eye that have nerve cells that allow us to see. Diabetic retinopathy affects the small blood vessels in our body from the head to the toe, and also can affect the retina. After many years of diabetes, you can get small blood vessel disease in the retina, which can cause leakage of blood vessels and a lack of oxygen to the retina. One of the main problems that we see with diabetic retinopathy is macular edema, which is fluid that builds up under the macula or the center part of the retina. As this fluid builds up, patients can experience blurriness in their central vision or wavy lines. We treat this leakage under the macula with either intravitreal injections to stop the leakage or focal laser treatment to small microaneurysms in the retina that can cause leakage from diabetic retinopathy. It is very important for patients who have type 2 diabetes to be checked annually from the time that they are diagnosed with diabetes, and for type 1 diabetic patients after the age of 9 for an annual retinal evaluation. Patients can have diabetic retinopathy even without any symptoms, so it is so important to have a routine annual evaluation, including a dilated examination. So in summary, diabetic retinopathy is one of the top 3 causes of moderate vision loss in America, and it is so important when you have a diagnosis of diabetes to have an annual dilated retinal evaluation.